Welcome to Medi-Fax This Week in Neurosurgery. This week's episode is for patients who have been diagnosed with malignant brain tumor. It is important to know that a lot of tumors of the brain are benign. That is, they are not cancerous. As a result, patients should not necessarily be anxious when they are diagnosed with a brain tumor. We are, however, going to discuss how we currently manage primary malignant brain tumors in Regina, Saskatchewan, in Canada. I am not going to discuss how patients present, since it varies from person to person. The common tests that we perform include a CT scan of the brain. We also do MRI scan. We are currently doing MRI scan in almost all the cases that we suspect of having a malignant brain tumor. This is what an MRI scan machine looks like. This is an example of an MRI image of a malignant brain tumor. This is another example of a malignant primary brain tumor. The single arrow is pointing to the brain tumor, and the double arrow points to swelling around the tumor. The option here includes surgery. It is about the only way that we can obtain a specimen that we send to the lab to decide specifically what the nature of the lesion is. Prior to surgery, we would do another scan with markers on the patient's head. This would allow us to accurately localize the tumor at the time of surgery. We usually try to perform what we call gross total resection of the tumor. This means that we remove as much of the tumor as we can safely do. The procedure usually takes 2 to 3 hours under general anesthesia. This is an example of the postoperative MRI, and you would note that most of the tumor has been removed. We usually leave a catheter inside the patient's head to monitor the pressure, and patients usually go to the intensive care unit for a day or two. Most people, barring any complications, usually stay in hospital for about a week. Potential complications will be discussed with you by your neurosurgeon as they vary from case to case. You should note that you will be seen at the Lemblé Cancer Hospital, which is attached to the Pasqua Hospital, at a later date by a radiation oncologist and a medical oncologist. I have as my guest today Dr. Patricia Tai. Dr. Tai is a clinical professor of radiation oncology at the University of Saskatchewan. I have reached her by Skype. Dr. Tai, welcome to Medi-Fax This Week in Neurosurgery.
Thank you.
Dr. Tai, this 59-year-old man has had as much of the tumor that we can safely remove taken out. What should be the next step?
Post-operative external beam radiotherapy is recommended as standard therapy for patients with malignant primary brain tumor.
Please tell us, how soon after surgery do you usually commence radiation for malignant brain tumors?
Within 2 to 6 weeks after surgery, this allows time for the surgical wound to heal and for the patients to recuperate after surgery.
Thank you. I had hoped to have with us today a medical oncologist, but he has been unable to attend. The Saskatchewan guidelines, which is a modification of the Canadian guidelines for primary malignant brain tumor, indicates that we would give chemotherapy during the time of the radiation. And the chemotherapy comes in tablet form. It is also usually continued even after the radiation is completed. It is continued for several months. And then, so that's about all we're going to say about that at this point. And I think we've covered most of what we want to cover. Dr. Tai, what special comments would you like to make at this point?
Just to let our patients know that our whole team, including neurosurgeons and the oncologist, are here to help them go through all the treatments smoothly. Thank you for inviting me to speak to them today.
Thank you for participating. For the patients listening, you should note that this is a general information for teaching purposes only. You should definitely talk to your doctor for specific information pertaining to your case. Have a great day.